Alright, so this integrity is going to be on sexually transmitted infections or STIs. So STIs are transmitted via sexual contact, so this can be oral, anal, or vaginal. All STIs have an incubation period in which they're latent or subclinical, and this is when transmission from an asymptomatic but infected to another person can occur. If a patient is tested during the incubation period, the test is going to come back negative, so they have no clue that they have it. STIs can be associated with discharge, lesions, bacteria, or viruses. People at high risk for STIs include people who had intercourse before the age of 18, have multiple partners in a non-monogamous relationship, substance abuse, sex workers, and the most common one is inconsistent and incorrect use of barrier methods. So the best form of protection, number one, is abstinence. This is the only 100% definitive way to prevent STIs. The second one is a latex male condom, and patients need to do correct and consistent use. Nursing management for STIs. You're going to discuss decreasing exposure, so talk about the risk factors. You want your patient to practice safer sex practices, including abstinence, monogamy, and correct and consistent condom use. You want better community education, and teens are a primary target for this teaching. Interventions include supportive counseling, active listening, accurate info, and referral to support. Patient teaching for STIs, taking meds as directed in order to decrease resistance, test and treat all partners, either abstaining from sex or using latex condoms. Follow-up, so they're going to get recultured, and also have your patient verbalize their concerns. You want them to practice proper hand hygiene and proper hygiene overall, so hand washing. And signs and symptoms of complications, some include abdominal pain, which could be indicative of PID. Alright, so now we're going to talk about chlamydia versus gonorrhea. So chlamydia is the most common, and this is caused by gram-negative bacteria. It's transmitted via vaginal, anal, or oral sex. So chlamydia is known as the silent disease because it's usually just put off as asymptomatic, or it's like, oh, it's just discharge. In men with chlamydia, they're going to have urethritis, so this can have dysuria or discharge, proctitis, which they could have rectal discharge or pain with defecation, and epididymitis, which is scrotal pain. In women with chlamydia, they might not have any clinical manifestations, or they might just think they have a UTI. So cervicitis, such as spotting, they might have urethritis, which is dysuria, frequency, or polyuria, and also a patient might experience painful intercourse. Diagnosis of chlamydia include the DNA amplification test. To treat chlamydia, you're going to use azithromycin, 1 gram PO in a single dose. Nursing assessment for chlamydia include physical exam, sexual history, how many partners, whether or not they're in a monogamous relationship. You're going to get cell cultures, so NAT is going to detect chlamydia, DEA is going to detect antibodies, and EIA will detect any antigens. You're also going to test your patient for other STIs. Patient teaching is to abstain from sex for 7 days after treatment. They have to contact and treat all sexual partners and be retested in 3 months. So chlamydia is reported to the Department of Public Health, so make sure you report it. Gonorrhea is the second most common STI. It's caused by a gram-negative organism that's spread via sexual contact, so oral, vaginal, or anal sex. Clinical manifestations in men, they're going to have urethritis, which they have dysuria and purulent discharge 2 to 5 days after exposure. Women can be asymptomatic, or they could have vaginal discharge, dysuria, frequent urination, and menstruation changes. Diagnosis of gonorrhea includes cell culture, such as EIA, NAAT. You could get a gram stain, check the DFA, or other STIs. Treatment is dual therapy, so this is IM ceftriaxone and PO azithromycin. And gonorrhea has to be treated very quickly because it's highly infective. Nurse assessment, get a good history, sexual history, and physical exam. Patient teaching, they have to abstain 1 week after treatment from sex, and STI location can be anywhere, so it can be in your throat, eyes, etc., depending on wherever you get that transmission. Complications of STIs. So in women, pelvic inflammatory disease, or PID, is an ascending inflammation disorder. Clinical manifestations of PID include lower abdominal pain that's very similar to appendicitis. Adverse effects include infertility. Epididymis in men, so basically adverse effects of this include infertility and reactive arthritis. Alright, genital warts and genital herpes. So genital warts is caused by HPV. It has a 3 to 4 month incubation period, has links to cervical cancer, anal, rectal, and penile cancer, and some HPV types are actually harmless. So genital warts, clinical manifestations are single or multiple papillary growths that are white, gray to pink or fleshy color. It's going to have itching with anal rectal warts, and there's going to be transient clearing after 4 to 5 days, but with this transient quote-unquote clearing, the patient's still going to have the virus, only the warts are going away. In male, they're going to have warts on their penis, anus, urethra. Women can have it on their vulva, vagina, cervix. Diagnosis for genital warts is the appearance of the lesions. Treatment, you can prevent genital warts with Gardasil. So this is to prevent HPV and cervical cancer. It's given between the ages of 11 to 12. It consists of 3 IM injections, and you want to make sure your patient gets it before they participate in sexual activity. Chemical and laser removal of genital warts. 80% are removed with TCA, in which the warts are burned off. You have to make sure to get the treatment on the wart itself, not the skin. And BCA is another use. Nursing intervention, so you want to assess history, physical exam, assess the lesions, get HPV DNA. Teaching, so for genital warts, the treatment does not destroy the virus. Recurrence and reinfection are possible, and long-term follow-up is needed. Genital herpes, so herpes are lifelong. They're very common in 85% of the population. So herpes simplex virus is the cause. It's going to enter via the mucous membrane and any breaks in the skin. So any compromisation of mucous membranes. There's HSV1 and HSV2, so herpes simplex virus 1 and 2, and it can enter the nerves and become dormant. Genital herpes, clinical manifestations include severe pain, might have burning, itching, tingling. They'll have a uni or bilateral lymphadenectomy, and the first outbreak is extremely painful. Complications, so teach your patient that auto-inoculation is possible, so your patient has to perform hand hygiene. And if you get herpes simplex keratitis, which is in your eyes, this can lead to blindness. Diagnosis is done via a visual exam and HSV2 serological testing. Treatment for genital herpes includes acyclovir or valacyclovir. So the primary infection, the treatment's got to be longer, so probably between 7 to 10 days. And recurrent infections, they're going to have less treatment. Patients might choose to participate in suppressive therapy, but since exposure, like with subsequent infection, the clinical manifestations are going to decrease. Most people don't tend to utilize suppressive therapy. Severe genital herpes are treated with acyclovir and oral antivirals. Nursing intervention, you want to prevent spread, so number one thing is to have intact skin and mucous membranes. You want to help your patient identify triggers, make sure they're getting yearly pap smears. If they have any lesions, they should abstain from sets. And also, if they don't have any visual lesions, there's still shedding of the virus, so it can still spread. So if your person is symptomatic management, make sure they do not put Vaseline on it. They can have fever, malaise. So if they feel like crap, you can give them ibuprofen or Tylenol. Have them rest and drink fluids. So if a patient has an episode, make sure they know how to take antivirals for an outbreak. And diagnosis of genital herpes is devastating since it's lifelong and incurable. You want to make sure your patient knows that they have to, or they should, disclose that they have genital herpes to their partner. Also, nursing management, counseling, and judgment-free zone for your patient. Alright, so the last one we're going to talk about is syphilis. So syphilis is quote-unquote on the rise. So it's caused by Treponema pallidum, and it's like a spinal sheet, and it enters via breaks in skin or mucous membranes. It's spread by sexual contact, contact with infectious lesions, or needle sharing by IV drug users. So phases, the primary phase is when there's a chancre. So this is a painless ulcer. So patient might not even know it's there. There's lymphodectomy and genital ulcers. Secondary, there's going to be flu-like signs and symptoms. Patient's going to have fever, sore throat, headaches, and rash. A latent phase, patient's going to be asymptomatic. And late and tertiary phase is severe. Patient can have aneurysms, heart failure, heart valve insufficiency, general paresis. Complications, there can be irreversible damage to bone, skin, and liver, or if the patient has neurosyphilis, this is irreversible. Diagnostics for syphilis include serologic testing, a transperineal blood test, which is FTA-ABS, to check for the antibodies. You can do CSF testing via a lumbar puncture. Always get a CT before a lumbar puncture, because if there is syphilis in the CSF, this means it's in the brain, so this is going to lead to neurosyphilis. Treatment for syphilis is penicillin. So if it's primary, secondary, or early latent, you're going to use penicillin IM in a single dose. If it's like late stage, you're going to do 3 IMs at 1 week intervals. The sooner the treatment, the better, and neuroscience and symptoms are irreversible. So patient has Swiss cheese brain. Nursing interventions include health promotion. So this includes teaching your patient to abstinence, monogamy, latex condoms, inspecting genitals, annual screening, vaccine facts, and correcting any misconceptions your patient might have. Other nursing interventions include psychological support, so do this in a non-threatening way, be your patient's supporter, and also teach your patient follow-up care, and also promote proper hygiene, specifically hand washing. Alright, thank you very much.